You know, in pediatrics, there's several big areas, but one of the most important areas we really need to focus on is the ability to de-silo funding and ability to deliver and pay for integrated behavioral health in primary care settings. And with children, it's really, really important that we start this really early, all the way from infancy into adolescence. And in very young children, families are not going to take their young children to a specialty mental health service. Certainly there's problems when you get older with stigmas and wanting to do that, but really in a 0 to 8 space, they don't belong in a specialty mental health setting. We really should be delivering that care to the whole family in those early ages and getting upstream. And sometimes those diagnoses won't qualify, certain codes don't work. We need to just be able to provide the needed services. I think the pediatricians are really embracing and see the value of having psychologists and social workers and developmental therapists and other areas within the primary care setting. We're just really struggling to figure out how to make the nuts and bolts work from a financing, especially because of the siloed funding streams in the past. I think we all have to do a lot of education, understanding, self-reflection, and then it begins to make sense, right? We all know from raising our own children or our nieces or nephew or our community in schools that we do have to do things differently. We don't know exactly how to do this and exactly which things should be happening in the healthcare office, the education setting, our community-based settings. So there's a lot of work in Oregon and especially in the Tri-County area around kindergarten readiness. And there are healthcare providers and education providers and social services and foundations and philanthropic investors and the business community all coming around the table saying, we need to change how we're doing this. And it's going to take time and energy and pilots or experimenting and figuring out how to do it. But if we stay siloed with human services and healthcare and education, if we silo the delivery and we silo the funding, we're not going to get where we need to be.